therapist, and today we are live before treatment, and today date is 18th of August 2023, and the future we are going to be post treatment lives. So please subscribe our YouTube channel and don't forget to watch the post treatment live. And today we have few patients. They are having some voice problem. I'll be showing to them. You can say hi.
Hi.
So they are facing some voice problem, and they came from different places. In fact, we did yesterday live also. They were supposed to come in yesterday group session, but because of some exam and all, they got delayed. So we are starting today their treatment. So I thought let's do live. And in fact, we'll be doing post treatment live also. तो नमस्कार दोस्तों, आप सभी का स्वागत है हमारे YouTube चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पर। और आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं, और जो हमारे साथ पेशेंट हैं इनको कुछ वॉइस की समस्या है। इनको एक्चुअली आना था कल, लेकिन कुछ एग्ज़ाम की वजह से नहीं आ पाए थे कल, तो आज हम लोग उनका ट्रीटमेंट स्टार्ट करेंगे। और जैसा कि मैंने बताया, आज डेट है 18th of August 2023, और भविष्य में हम लोग ट्रीटमेंट के बाद भी लाइव होंगे। तो आप लोग हमारे चैनल को सब्सक्राइब कर लीजिए, बेल आइकन को प्रेस कर लीजिए, ताकि भविष्य में जब ट्रीटमेंट के बाद लाइव हो तो उसको भी देख पाएँ और चेंजेस कितने हुए, क्या हुए, उन सबको ऑब्जर्व कर पाएँ। और एक पेशेंट हमारे साथ हैं जो मल्टीपल कंसल्टेशन का भी शिकार हैं, तो वो भी आपसे रूबरू होंगे, बताएंगे अपने एक्सपीरियंसेस को। तो एक एक करके हम लोग आगे बढ़ते हैं, और जिन बिंदुओं पर हम लोग चर्चा करेंगे, द टॉपिक विच वी आर गोइंग टू कवर इन दिस लाइव विल बी इंट्रोडक्शन अबाउट मी, इंट्रोडक्शन अबाउट आवर सेंटर एंड आवर यूट्यूब चैनल, and you will be listening the patient voice before treatment. And of course today it is 18th August 2023, and before starting speech therapy, what information required? So what are the information required before starting the speech therapy? तो speech therapy start करने से पहले किन बातों के बारे में जानकारी प्राप्त करनी चाहिए पहले, तब स्पीच थेरेपी स्टार्ट करनी चाहिए, इस पर भी हम लोग चर्चा करेंगे। क्योंकि कई सारे ऐसे पेशेंट होते हैं जो झोला छाप किस्म के लोगों का शिकार बन करके सोचते हैं कि वो तो एक स्पीच थेरेपी ले रहे हैं, वॉइस थेरेपी ले रहे हैं, एक प्रोफेशनल्स ले रहे हैं। फिर नेक्स्ट होगा काइंड ऑफ सर्विसेज वी प्रोवाइड, देन विल बी टॉकिंग ऑन हाई पिच वॉइस, साइन, सिम्टम, कॉज एंड ट्रीटमेंट, and then I'll be talking, is there any side effect of voice therapy or self treatment? Next will be how to contact us. Next will be, do we have accommodation facilities at our center? After that, I will be talking on which treatment is preferred first, voice therapy or surgery for pitch correction. And then we'll be talking on, do we have any branch of our center? Next will be, which treatment is preferred first, voice therapy or surgery for pitch correction? And next will be, do we have any branch of our center? After that, we'll be talking on cost and duration of treatment for voice and speech disorder. Next, we'll be talking on how do we treat international patient, online or offline. Next will be, is saying 1, 2, 3 or saying in new voice is the stage of treatment or the end of the treatment. Next will be, is voice therapy result is permanent. Next is effect of food and drink on voice. And after that, I'll be announcing the next batch of group therapy. So that I'm doing now only. Our next batch of group therapy is going to be start on 5th September 2023. 5 सितंबर 2023 को हमारा अगला ग्रुप वॉइस थेरेपी का बैच स्टार्ट हो रहा है। Next will be, who are the good candidate for voice therapy. After that, I'll be talking on, is all high pitch voice or female voice is puberphonia. Next is online facilities for communication disorder at our center. And I'll be giving some tips to keep your voice healthy, and then I'll be replying the question from the live chat. So thank you all for joining us and watching us, and let's go one by one. So introduction about me. My name is Sanjay Kumar. By profession, I'm a speech language pathologist and audiologist, and I have studied from AIIMS, Delhi. I did my Bachelor of Science Honours in Speech and Hearing from All India Institute of Medical Science, New Delhi. My degree name is Bachelor of Science Honours in Speech and Hearing, and I did my master from the University of Mysore, and my master degree name is Master of Science in Speech Language Pathology. And my area of interest is treating voice disorder, because I'm an audiologist and a speech pathologist both. So at our center we do hearing testing, hearing evaluation, hearing aid dispensing, hearing aid fitting, everything we do related to the speech and hearing disorder. But my passion is treating voice disorder. And our center name is Sanjay Speech, Hearing and Rehabilitation Center, that we started in the year 2010. From then onward, we are creating awareness of communication disorders, non-surgical management, and we are treating patients having different speech and hearing problem. And we don't have any branch of our center, and you can find our center on the Google map also. Once you'll put Sanjay Speech, Hearing and Rehabilitation Center in Bangalore, and even on our website also the location is mentioned and our website you can see in the back, Speech Therapy India .in. And next is our YouTube channel. So we started our YouTube channel in the year 2010, and from then onward we are creating awareness about the non-surgical management of communication disorder with the success stories of the patients of having different voice disorder. And we have created hope across the globe. So our client list include people across the globe, from all over the world. People has taken the treatment from, means I can say all the continents of the world. मतलब सारे महादेशों से लोग ट्रीटमेंट ले लिए हैं यहाँ पे, चाहे वो ऑनलाइन मेथड हो और ऑफलाइन मेथड. इनफैक्ट yesterday one guy came from Poland also, I think, in this group. So ये रहा हमारे YouTube चैनल का संक्षिप्त परिचय, and I'll be showing our YouTube channel. You can see also. So you can see it's this is our YouTube channel, and if you can see there are thanks for your love, almost 21,000 subscribers are there, and 1.8k videos are there. So you'll find different pre and post treatment videos. And to understand our work in more detail, my suggestion is that you explore our YouTube channel playlist. So once you explore our YouTube channel playlist, you'll find different communication disorder video, and that will be having before treatment, after treatment videos. And apart from that, you'll be knowing that when we start the treatment, we tell the date, and when they finish the treatment, we also tell the date. So you'll get an idea about the treatment duration and how much changes it happen. So all the ideas you'll be getting, and what are the different communication disorder for which we provide our services. So I suggest please explore our YouTube channel playlist, and also I suggest to please share this kind of playlist. You don't know who is maybe having the voice problem or a speech problem, and they are not knowing where to go, how to go. So they will get some hope, motivation, and they can reach to a right place. So please share this playlist also after watching, if you are liking our videos. So this was our YouTube channel's introduction, and oldest video you will find in the year 2010. If you can explore our YouTube channel, just I'm showing that when we started it. So if you are going to the videos part, so the option will be oldest. So if you go to the oldest, so you can find 13 years ago, you'll find. So from then we are creating awareness, and after that you can just check all these videos are 13 years ago and come down. And when I was started creating awareness across the globe, some new healthcare quacks also came. Those who took treatment from us, or maybe whose relatives took the treatment from us. So in that way, some healthcare quacks are also claiming for the treatment, and many patients are coming here for after spoiling their vocal cord and voice. So it's very, very important, and very my responsibility also to create awareness to the innocent people, how they will identify who is a right professional and who is a healthcare quack. तो एक कौन सा व्यक्ति एक राइट प्रोफेशनल है, कौन झोला छाप किस्म का है, इसको जानने के लिए फर्स्ट यू ट्राई टू फाइंड आउट दैट पर्सन हु इज क्लेमिंग ही इज अ स्पीच पैथोलॉजिस्ट और स्पीच थेरेपिस्ट ऑडियोलॉजिस्ट, फ्रॉम विच कॉलेज ही हैज स्टडीड, and from which university his college was affiliated, what is the name of, if it is a medical college, what is the name of the medical college, and then what is the full form of the degree, and in which year he got the degree, and if he registered in the Rehabilitation Council of India or not, and if he has registered, if he has shared the RCI number, RCI CRR number or not. Like every audiologist, speech pathologist, speech therapist will be having RCI CRR number. And once you go to the Rehabilitation Council of India's website, once you put the RCI CRR number, you will find his qualification, and he is registered, he is not registered. So if somebody is saying that I am a speech pathologist, audiologist, especially in Indian scenario, his responsibility is there also to just provide his RCI CRR number. The moment you are telling I am certain professional, so for that you should provide the evidence. And if he is not providing, that can be a symptom of healthcare quacks. And if he is providing also sometimes what happens, some like a speech and hearing technician, ear mold technician, a special educator, psychologist, they will be also having RCI CRR number. So it doesn't mean that they are a speech pathologist and audiologist. Of course, if you have to take the psychological service, so you need to check that psychologist is having the RCI CRR number as a psychologist. The same way, if you are going to take a speech and hearing services, then you have to check that person is having like RCI CRR number as a speech pathologist and audiologist. और कैसे एक आम इंसान जानेगा कि वो कौन फेक है कौन नहीं है? तो पहला ये एक हो गया कि RCI CRR नंबर पता कीजिए. अगर RCI CRR नंबर सोशल मीडिया में नहीं दिया है, वेबसाइट पे नहीं दिया है, अपने वीडियो के डिस्क्रिप्शन में नहीं दिया है, तो वो फेक हो सकता है। अगर ऐसा भी हो सकता है कोई फेक RCI CRR नंबर दे दे लोगों को इम्प्रेस करने के लिए, तो उसकी जांच पड़ताल आप कर सकते हैं, और जांच पड़ताल करने के बाद RCI को रिपोर्ट भी कर सकते हैं कि वो गलत जानकारी दे रहा है। तो कैसे करेंगे, अब इसके लिए मैं बड़ा ही आसान तरीका बताने वाला हूँ, आप खुद से चेक कर सकते हैं। देखिए मैं कैमरा टर्न कर रहा हूँ, यहाँ पे जैसे जाइए, अगर आप जाते हैं गूगल सर्च में ढूंढिए रिहैबिलिटेशन काउंसिल ऑफ इंडिया लिखिए, जब डालेंगे तो ये वाला मैंने स्क्रीनशॉट लिया है मोबाइल से, तो इस जगह पे आप पहुँचेंगे, इसमें फिर क्लिक कर दीजिए अबाउट अस। तो आपको रिहैबिलिटेशन काउंसिल ऑफ इंडिया का वेबसाइट मिलेगा, यहाँ पे 3 लाइन होंगी, इस 3 लाइन पे क्लिक कीजिए, फिर आप पहुँचेंगे यहाँ पे। तो फिर जब यहाँ पे जाएंगे तो आप नीचे की तरफ आइए, यहाँ पे आपको एक मिलेगा, अगर आप मोबाइल से सर्च कर रहे हैं तो CRR रजिस्टर्ड, तो यहाँ पे क्लिक कीजिए। जब आप CRR रजिस्टर्ड को क्लिक करेंगे तो यहाँ पे पहुँचेंगे, इस जगह पे सर्च, सेलेक्ट सर्च कैटेगरी, तो इसमें सेकेंड वाले को क्लिक करना है, सर्च बाय CRR नंबर। यहाँ थोड़ा धुंधला दिख रहा है, लेकिन आप क्लिक करेंगे तो ओपन होगा। जब ओपन होगा तो इस जगह पे आप पहुँचेंगे, सर्च बाय CRR नंबर। तो अब यहाँ पे CRR नंबर डालना है। तो आप पूछेंगे कि CRR नंबर हम कैसे डालें, तो जब कोई व्यक्ति अपने आप को स्पीच थेरेपिस्ट ऑडियोलॉजिस्ट कहता है, तो उसकी रिस्पॉन्सिबिलिटी है कि वो CRR नंबर प्रोवाइड करे, जहाँ पे कहेगा वहीं पे प्रोवाइड करना है। जैसे मेरा CRR नंबर डालना है तो मेरे वीडियो के डिस्क्रिप्शन में आपको मिल जाएगा, तो उसी तरह से दूसरों का पता कीजिए। और ऐसा भी हो सकता है लोग आपको बेवकूफ़ बनाने के लिए कुछ भी CRR नंबर डाल दें, तो आप उसकी जांच पड़ताल कीजिए। CRR नंबर यहाँ डाल करके सबमिट कीजिए। जब सबमिट करेंगे तो आपको ये पता चलेगा कि उसके पास बैचलर तक की डिग्री है, मास्टर तक की डिग्री है, रजिस्टर्ड है कि नहीं रजिस्टर्ड है। अगर वो फेक होंगे तो CRR नंबर देंगे भी नहीं, और अगर कोई दिया है और अगर ऑडियोलॉजिस्ट स्पीच पैथोलॉजिस्ट के रूप में रजिस्टर्ड नहीं है और ऑडियोलॉजिकल सर्विसेज स्पीच पैथोलॉजी से रिलेटेड सर्विसेज दे रहा है, तो इसका मतलब है कि वो एक हेल्थ केयर क्वैक है। तो इस तरह से आप जानकारी जुटा सकते हैं। तो अब हम फिर आगे बढ़ते हैं। ये रहा, हमारी कोशिश रहती है अवेयरनेस क्रिएट करने के लिए कि अब है नेक्स्ट, यू विल बी लिसनिंग पेशेंट्स वॉइस बिफोर ट्रीटमेंट हु केम ऑन टुडे 18 अगस्त। तो अब मैं बुलाना चाहूँगा भरत को। भरत आ जाइए आप, प्लीज़ कम। Yeah, Bharat, tell us, we are live at our YouTube channel, so what exactly problem you are facing, why you came here?
My name is Bharat Pandey and I am 20 years old. I hail from Kanpur and I did my schooling from NLK. I have high pitch voice, feminine type of voice, and I can't shout, And while in the crowd, it's hard for me to speak, and in the class, like I can't speak my attendance. And in the crowd, it's very hard for me to speak. And in the mic also, people sound like it is high pitched, and on phone, people call me madam. Sometimes misaddress me.
ठीक है, थोड़ा सा हिंदी में भी बात करते हैं। तो क्या समस्या होती है आपको डे टू डे लाइफ में इस वॉइस की वजह से?
डे टू डे लाइफ में मतलब कॉन्फिडेंस लो हो जाता है और लोगों से बात करने में दिक्कत होती है। जैसे क्राउड गैदरिंग में बात करने में काफ़ी प्रॉब्लम्स हो जाती है। माइक पे तो मतलब कि काफ़ी हाई पिच आती है। फ़ोन पे से कॉल सेंटर से आता है या फिर अनजान व्यक्ति से आता है फ़ोन, तो मुझको मैडम करके एड्रेस करता है।
ठीक है, तो हम लोग ट्रीटमेंट के बाद भी लाइव करेंगे। हम लोग 8 दिन के अंदर आपका प्रॉब्लम सॉल्व करेंगे। थैंक यू कि आप इतनी दूर से आए और हम पे भरोसा किया। और हम नेक्स्ट पेशेंट को बुलाना चाहेंगे, वो हैं प्रसाद। या आप बैठ जाइए। So Prasad is a very interesting case. He has gone for different places. He has a lot of experience of previous treatment. So Prasad, tell exactly what problem you are facing at this moment.
Actually, I'm problem also. Initially, I'm facing in college attendance, or some of I am completed masters in degree. I am speaking in some of seminars and of group discussions or jam sessions is there. That time my speech is female voice is. Some of members or some of persons are laughing and the comment is there. My pitch voice is high.
Okay, so from puberty onward you are facing. What is your age now?
Age is 30 years now.
30 years. So before coming here, have you tried any treatment, any other places?
Yeah, I am trying treatment in 2021. Started in treatment, and also before I am consulting 2015 one of other doctor also.
So in 2015, step by step, tell what the doctor told in 2015.
2015 he suggested surgery.
Okay.
And also the person suggested surgery and of under parents signature.
Okay, so your parents were not ready for surgery.
Yeah, parents are not encouraging or no needed.
Okay. Then next time you
Next time
in 2021 you went.
yeah, COVID time I am reached 1 of hours.
So how much was the duration during the treatment? The first?
In first treatment is taking 10 days. Initially, 5 days I am practicing center, speech therapy hospital or center. I am taking, after I am practicing my home.
Okay, so total duration was 10
days in
Okay.
Hyderabad.
Hyderabad. And after that, where you went?
Chennai.
Okay, there how many days you took treatment in the Chennai?
In Chennai hospital or center, I am taking in 5 days of treatment. Is completely different treatment I am facing that center.
Okay, so in the Chennai you took 5 days treatment.
Yeah.
So what the doctor told after 5 days?
After 5 days, doctor is told you practice in home continuously.
So the voice didn't change.
In that time is some few changes there voice
Okay,
coming.
but that was not stable.
Not stable in my life. After I am
Okay, again you are facing the problem.
again also same.
So what was the procedure in Chennai? It was a voice therapy or surgical procedure?
So actually thread off is there, tongue inject.
Okay, some thread tying did in
Chennai.
the okay.
That situation 2 days is swelling is there.
Bleeding was also there.
Some persons are bleeding.
Swelling problem was also there.
Swelling is too much.
Swallowing, matlab when eating problem was there. What you are eating that time?
That time I am eating idli and also taking juices.
Okay, so some eating difficulty was also there during the treatment process.
Eating difficulty, lot of swelling is there.
Okay, so after tying the thread, what the doctor told?
After 2 days I am practicing without thread. After
so under the supervision of the doctor?
That situation in first day, last day 30 minutes, for last day 30 minutes, just supervision, before and after voice, just supervision.
Okay, so means the doctor tied the thread and then he sent to some other person to do some practice, and you did 5 days practice, but it was not helpful, so you came here. So, and we will not be tying thread. I'm just trying to create awareness. We will be not be tying any thread. There will be no swelling. There will be no bleeding here. We'll just treat this problem by voice therapy procedure. And I'm studied from AIIMS Delhi, All India Institute of Medical Science, New Delhi. And our client list include people across the globe. People come from all over the world. So I don't feel why so much painful treatment method, and that also its voice is not getting stable.
Yeah, I'm also watching your videos and follow YouTube also. That's why awareness to come, and this is the best.
Okay, fine. So I'm also trying to create awareness. Like, see what happened in some of the videos I see in the social media. The people will show the kind of video where the patient is saying in high pitch voice. Next, they will show in low pitch voice. So this can be a stage of treatment, not the end of the treatment. End of the treatment means patient should talk at the conversation stage. Sometime I have seen some videos, people try to impress. They will be saying one in high pitch voice or I in the high pitch voice, next one in the low pitch voice. So that is a phrase level, a word level we can say that. Very simple way, if your plan is to go to Delhi and somebody is taking you till Ghaziabad. So is it Delhi? Not now. You have to reach to Delhi. In the middle of the way, they are leaving you. And then what they will tell, do this practice for 1 month, 2 months. Here what we do before treatment, after treatment, we do the live. So what changes are there in front of us? And it's not like once you go home, then change will be happen. And if somebody is claiming, like I have treated thousands of patients, so just check in those social media pages, how many videos are there in pre and post treatment? Out of 1,000, how many are you able to find pre and post treatment? And then you get calculate the percentage of success in that way.
Initially, this video also shared one of my friend also just visited.
Okay, so my role is, see, I am a speech pathologist. And if someone is entering in my area and trying to just spoil the patient having communication disorder, it gives pain to me. Like if I am a speech pathologist, I am treating someone's having the teeth problem. So the dentist, what they will feel that, and I am spoiling their teeth. So they will feel pain. Similar kind of pain I am also feeling. Somebody who is trained in the surgery, somebody who is trained in the medicine, somebody who is a special educator. And and they are trying to treat related to the communication disorder problem, speech and hearing problem related to our field. And then they are spoiling the patient's voice and communication, and then the patient is reaching to us. So my idea is to let the public know that, and that's why I was telling, how do you know who is a speech pathologist, audiologist, or who is a healthcare practice? In the beginning only I have shown they have registered in the Rehabilitation Council of India or not. That way you need to explore that. Okay. So anyway, we'll be doing post-treatment live as well. So tell in your mother tongue, what is the problem, why you came?
My mother tongue is Telugu. I came. Andhra Pradesh, my native state.
Okay, so tell in Telugu, what is the problem, why you came?
నేను యాక్చువల్గా నా వాయిస్ అనేది ఫిమేల్ వాయిస్ సమ్టైమ్స్ ఎక్కువ వస్తుంది. సమ్టైమ్స్ కస్టమర్ కేర్ కానీ నేను హైదరాబాద్లో వర్క్ చేసేవాడిని. అప్పుడు అదర్ పర్సన్స్ కాల్స్ ఇచ్చినప్పుడు మేడం ఇలా డిఫరెంట్గా మేడం అని ఇస్తూ ఉంటే తర్వాత నేను హాస్పిటల్ రీచ్ అయ్యాను. సర్జరీ అన్నారు, బట్ గవర్నమెంట్ హాస్పిటల్ రీచ్ అయితే స్పీచ్ థెరపీ బెస్ట్ అన్నారు, బట్ నేను సెర్చింగ్ చేయడం స్టార్ట్ అయింది.
Okay, no problem. That's fine. Just I wanted to share some voice in your mother tongue. So thank you so much for your faith, and we'll do the needful. And the next, you can take this chair and you can sit. There are some. This. So as I discussed, there are certain questions with answer I am going to give. The question was next. Kind of service we provide. I think that I already shared. To know that what kind of services we provide, please explore our YouTube channel playlist. So once you explore our YouTube channel playlist, I'll be showing once more. So you'll be knowing different communication disorder playlist, and each and every playlist will be having before and after treatment videos. So you'll get an idea what are the communication disorder for which we provide our services and how much changes happened, how much time it took. So please explore our YouTube channel playlist. And next is high pitch voice sign symptom cause and treatment. To understand the high pitch voice sign symptom is very easy. When you are a boy, there is a boy and his age is 14 years, 15 years, and is more than 14, 15 years. And when he's talking on the phone, people are still thinking he's a small child, or they are telling ma'am. So it can be a symptom of high pitch voice. And next is cause and treatment. Before understanding the cause and treatment, let's understand normal speech production mechanism. Once we understand the normal speech production mechanism, it will be easier for us to understand the abnormal. For normal speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds generate. Then we modify that sound into different sound with the help of our articulators like lips, tongue, jaw, teeth, palate. For example, if you want to say pa, both the lips are coming closer together and touching each other. When you want to say ta, tongue is coming between the teeth. When you want to say ka, back of the tongue is getting elevated and touching the soft palate. So each and every sound has own place, own manner of articulation. So when we say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cord moves, sounds generate, we modify that sound into different sound. In one sentence, there are so many words. In each word, there are so many sound. Each sound is own place, own manner of articulation. So it is little complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, there will be fluency problem, like we have seen in case of the stammering. If there will be place of articulation is wrong, manner of articulation is wrong. For example, for ta production, tongue should come between the teeth, and you are putting your tongue somewhere else. So there will be pronunciation problem. Sometimes pronunciation problem will be related to the hearing impairment. So we do hearing testing, and if needed, we dispense hearing aid as well. And let's now come to the high pitch voice. So as I told, here we have larynx, and inside the larynx we have two string-like structures known as vocal cord. So once you put air pressure below the vocal cord, then vocal cords start moving and sounds generate. So during puberty, what happens? In case of boys, the vocal cord mass length increases due to a hormone called testosterone. If vocal cord mass length increases, the pitch reduces. For example, just you can think about the guitar. If you have seen the guitar, in the guitar, thin string produces high pitch voice, shrill voice, and thick string produces low pitch voice. So before puberty, in case of boys, the vocal cord is like thin string of a guitar like a structure, so the pitch is higher. But during puberty, or we can say after puberty, due to the testosterone hormone, the vocal cords become thick string of a guitar like a structure, so the pitch should be ideally low. But sometime people like here is Bharat, because I did live already, you have listened his voice. What happens from childhood to puberty, he spoke in a high pitch voice. During puberty, vocal cord mass increased, length increased. Now the vocal cord is ready to produce the low pitch voice. but because of so many years habit, he was not able to switch on to the new voice. He was fine. I can say that little bit psychological reason also, we can say that in the beginning it was a psychological reason, but later with the time it has become psychological as well as the biophysical. So what he tried to do, because of his old habit, try to maintain his childish voice. But now because of the testosterone, vocal cord mass length has increased. The vocal cord is ready to produce the low pitch voice, but you want to continue your childish voice. So how it possible? Because vocal cord has become thick, and thick string produces low pitch voice. To maintain the childish voice, we can say unknowingly, what he did, he tried to vibrate thin edges of the vocal cord to maintain the childish voice. The vocal cord actually, it's a thick string of a guitar like a structure, but behaving like a thin string of a guitar like a structure. And when the guitar string will be the thin, the pitch will be higher. So, as a speech pathologist, what I am going to do, I will stimulate whole mass and whole length of the vocal cord. So instead of thin edges, the whole mass and whole length of the vocal cord will start vibrating. And once whole mass and whole length will be start vibrating, vocal cord, which was behaving a thin string of a guitar like a structure, will start behaving like a thick string of a guitar like a structure, and the pitch will be reducing. So here I am not going to replace your larynx. I am not going to replace your vocal cord. What you have, I will help you to explore in most effective manner to use. I remember sometime I get calls. I remember there was one guy and he called at our call center, and I also spoke to him. Sir, I have seen a guy in your YouTube channel. वाह क्या मस्त वॉइस है, मुझे ना मंजुनाथ की तरह वॉइस चाहिए. तो मंजुनाथ की तरह वॉइस होने के लिए आपकी वोकल कॉर्ड, आपके वोकल ट्रैक भी मंजुनाथ की तरह होना चाहिए. तो बहुत सारे ऐसे पेशेंट्स होंगे, देयर आर सो मेनी पेशेंट्स हुज वॉइस आर बेटर देन मी इवन आफ्टर द ट्रीटमेंट. क्यों? क्योंकि नेचर हैज़ गिवन द वोकल कॉर्ड इन सच ए वे, वोकल ट्रैक्ट in such a way that finally his voice is, after getting training from us, he is getting the best voice, even better than me. So the voice quality depends upon the vocal cord as well as the resonating cavity, starting from vocal cord till the mouth opening. जैसे कि आपने गिटार में देखा होगा, in guitar you have seen the what is going to what are the factors which are related to the voice quality of the guitar. One is string, other is the box, that resonating cavity. So here resonating cavity is starting from the vocal cord to till the opening of the mouth, that vocal tract plus the vocal cord. So that's why if you are new to our YouTube channel, so instead of watching one video, my suggestion is watch many videos to understand our work. Then you will get an idea. So here we don't replace the larynx and the vocal cord. What you have, we help you to explore in most effective manner, to use in most effective manner. That's why the changes for different patient will be different. So I was talking about high pitch voice signs, symptom, cause and treatment, and even like you can understand this high pitch voice problem in another way also, with the help of biophysics. Like in the acoustics, if you have basic knowledge of acoustics, if any string vibrates, there is a relation between the frequency, length and the tension of the vibrating string. So our vocal cord is also a string like a structure. Okay, so the frequency means in one, suppose this is the string, and in 1 second how many times like this is vibrating, we call it a frequency. And the psychoacoustic term for the frequency is pitch, and the unit is hertz in the. So if any string vibrates, the frequency and that relation between the frequency, mass, tension is n is equal to 1 by 2L under root T by M. N is here frequency, L is the length of the vibrating string, T is the tension of the string, M is the mass per unit length. So before puberty, vocal cord mass and length will be less, the N will be higher, because it's inversely proportional. N is equal to 1 by 2L under root T by M. If you can write, then you will get better idea. N is equal to 1 by 2L under root T by M. So before puberty, L and M are less, then N will be higher, pitch will be higher. During puberty, due to the testosterone hormone impact, L and M increasing, length and mass is increasing, the vocal cord mass I am talking here, then pitch reduces. The guys who are having puberphonia, they don't have any other problem, their mass and length has increased, so L and M are sufficient to produce the low pitch voice, but they are not vibrating whole mass and the whole length, they are vibrating only thin edges of the vocal cord. So if you are vibrating only thin edges, then in this formula N and M will be less, then N is higher. And if I'll be stimulate whole mass and the whole length of the vocal cord, so vibrating mass will increase, vibrating length will increase, L and M will increase, then pitch will reduce. So simple the biophysics is there. So there is no need to do some drama, tying thread and all in the uval. I have seen some patients that, but I don't know why they will be doing. But we have not tied any thread, and our number of patients are more. So I think it's more related to the vocal cord, what I personally feel. So because there was one guy who came, he was telling if somebody tried the some thread in the hanging structure in the saw pile. I think the guy Prashad, and then shouting, then doing some vocal exercise. I think if you know the right technique of voice therapy, tying thread, I don't think it's going to support anyway. Just vocal exercise will be, if the voice therapy doesn't work, there is a surgery, thyroplasty and all. And if you are going for thyroplasty, then also you have to take voice therapy. Then why not you should take voice therapy in the beginning. And suppose if you already here, so many patients come from even different country here, they must have tried in the local by the local speech therapist in their own country also, but it was not helpful. Once they came here, they improved. So I want to say that here the speech pathology is a very broad field, so everyone is not equally efficient to all communication disorder. So suppose speech pathologists work on the swallowing disorder also. अगर swallowing की problem होती है, on also they will be working, and they also work on the delayed speech and language. They will be working on neurological communication disorder. So they will be more expert. So suppose if you have gone to a speech pathologist who is more expert in the small children, delayed speech and language, and you went for the voice disorder and it didn't work, then don't get disappointed. You are not a good candidate for the voice therapy. Now you have to go for thyroplasty and such. No, you need to find some expert who are really expert in treating voice disorder. If it doesn't work, then you should think about the other method. So this I just wanted to create awareness. So I spoke high pitch voice signs, symptom, cause and treatment. And next is there any side effect of voice therapy or self treatment? So when you are taking treatment from a certified professional, there is no any side effect. But when you are taking treatment from healthcare quacks, or if you are doing self treatment, sometimes voice and vocal cord may damage. So always take treatment from a certified professional. Next is how to contact us. To contact us, it's very easy. You can go to the description of this video and you'll find our website. Click on that. You'll find our email ID, contact number on Google Map where is clinic situated. So you can call us. We'll do perceptual evaluation if needed. We'll suggest certain tests, and then we'll be able to comment on your problem, treatment duration, treatment cost, expected outcome, etc. Next is do we have accommodation facilities at our center? So our center is a clinic, so we don't have accommodation facilities, but our team will be supporting you to get the accommodation near to our center. Next is which treatment is preferred first, voice therapy or surgery for pitch correction? Based on my experience, based on my opinion, the voice therapy should be the first preferred method. Voice therapy should be the first preferred method. And next is do we have any branch of our center? Till now we don't have any branch of our center. Our center is only one. The name is Sanjay Speech Hearing and Rehabilitation Center, and that is located in Bangalore. Next is cost and duration of treatment for voice and speech disorder. So it varies. So my suggestion is if you want to know about cost and duration, please call us. We'll do the perceptual evaluation, and then we'll be able to comment on treatment duration and treatment cost. How do we treat international patient, online or offline? So we treat by both the mode our international patient. But after perceptual evaluation, we decide who can be a good candidate for online treatment, or who can be offline, or who can be a good candidate for any of the method. So for that, we do first perceptual evaluation, and then we decide. Next is saying 1, 2, 3 or saying in new voice is the stage of treatment or end of the treatment. So as I told in the beginning of this live, there are some social media videos. The patient is saying one in high pitch voice and next one he is saying in the low pitch voice. So that can be a stage of treatment, not the end of the treatment. Or if someone is saying in high pitch voice, next is telling in the low pitch voice. So that can be also a stage of treatment, but not the end of the treatment. So you should not get impressed by those kind of videos. Treatment is over. It means patient should able to talk at the conversation stage, not I, you, or just 1 or 2, amma, appa, 1, 2 or 3. Okay. So just inquire in detail if you don't get impressed by those kind of video. Next is voice therapy result is permanent? It's a very interesting question. I have seen relapse in 2 communication disorder at our center. One is called spasmodic dysphonia. Here there is no any spasmodic dysphonia patient. And another communication disorder is stammering. After treatment also we have seen the patient got problem again. Apart from these 2 problems, we have not seen relapse in any other communication disorder till now, but in the future anything can happen. And especially the more people come at our center are vocal cord paralysis and the pitch correction. These 2 kind of communication problem patients are more at our center. And this kind of people will be asking from me, sir, treatment के बाद पुरानी आवाज़ तो नहीं आ जाएगी? तो if I was thinking, if I will be telling, no, there will be no relapse, then why they will be believing me if they have the doubt? So it's better to ask this question from my old patients to whom we have treated 4 years, 5, 6, 7 years back. So during COVID pandemic time, I was free, my old patients were free. So I did so many patients live also, how they are feeling after 6, 7 years is over and how the voice is. And those live link I have given in a video. I usually suggest people watch this 35 minutes video in my YouTube channel comment box. So if you explore that 35 minutes video, in that description, if you go, all the lives link we have given, and my patient is telling how is his voice after 5, 6, 7 years. And in fact, their link also we have given before and after treatment, and after 6, 7 years, how the patient is telling about his voice stable or not. So you just explore that to get the answer about the relapse will be there or not. Effect of food and drink on voice. So after dinner, especially I say that don't go to the bed, because the acid which will form for the digestion of the food will accumulate at the throat level, and that may damage the voice and vocal cord. So there should be 1.5 hour to 2 hours gap between your sleeping time and dinner time. If very hot and very cold thing if you are taking, because vocal cord is a muscle, so that can impact or your voice quality as well, especially if you are a professional voice user. Avoid very hot or very cold thing. And next is announcement of next batch of group therapy, and avoid very spicy food. If you take very spicy food very frequently, the acid will form in the stomach, and while sleeping that will accumulate at the throat level. That may damage the voice and vocal cord due to the GRD, gastroesophageal reflux disorder. So next is announcement of next batch of group therapy. Then again I am repeating that our next batch of group therapy is going to start on the 5th September 2023. So my suggestion is, if possible, try to reach on 5th September only, not before, not after. So, and you can communicate with our team for the appointment. And who are the good candidate for voice therapy? So I say all in my every live, I say that before joining our center, if you are new at our YouTube channel and you are planning to come to our center for review, the message is, before joining our center, if you are thinking it will be wastage of time and money, my answer is absolutely you are right. And if you are thinking after coming here you will achieve something, then also you are right. So my suggestion is, if you are confused, take some more time, get final decision, then you can join. In confused state of mind, if it is there, take some more time to reach to a final conclusion. Because I have seen that 2 kind of people. I have seen that the treatment will be little delayed, or it will take more time, and sometime failure I have seen at our center. Those are not very confident, means they are not having, they are coming to the center, but at the same time they are lagging the faith. Suppose if I have suggested for particular problem to finish the treatment for 8 days, and they will disappear on the 4th day or 3rd day. In that case, I have not seen good result. And other cases, I have seen that those who are having the history of multiple consultation. Mostly I am seeing, not all the patient, many of my patients, those who are coming here, before coming here, they will try different places. And after that, what will happen? Their motivation, their hope will vanish. Because as I told, this is a psychological problem. So if some psychological problem is there, and already you have gone for multiple consultation, there it was not helpful. So it will be a state of mind where to bring you at motivated level, to bring you to follow my instruction, it's become more challenging, and treatment becomes more चैलेंजिंग. तो जो लोग मल्टीपल कंसल्टेशन का शिकार होते हैं, जैसे कि मेरे आने से पहले सारी जगहों पे ट्राई कर लिया, अगर फेल हो गए तो एक क्या मैसेज आएगा कि वो वॉइस थेरेपी के लिए सूटेबल कैंडिडेट नहीं है. एक चीज़ उनके अनकॉन्शियस माइंड में ये बैठ जाएगा, और फिर इसके बाद मेरे पास आएंगे, अच्छा सर का रिजल्ट तो बहुत अच्छा है, अब लास्ट में सर के पास चलते हैं. तो उनका जो माइंड होगा उस लेवल पे होगा, क्योंकि ये प्रॉब्लम साइकोलॉजिकल भी होती है ना, पिच प्रॉब्लम. मेरी प्यूबर्टी आई थी, मुझे प्यूबरफोनिया नहीं हुआ, लेकिन जिसको हुआ तो कहीं ना कहीं साइकोलॉजिकल प्रॉब्लम है ना। स्टार्ट साइकोलॉजिकल प्रॉब्लम्स हुआ था, बाद में बायोफिजिकल प्लस साइकोलॉजिकल दोनों हो गया। तो जो मल्टीपल कंसल्टेशन का शिकार होंगे तो उनका फिर क्या होगा कि वो साइकोलॉजिकल प्रॉब्लम इतनी हाई लेवल पे होगी कि उनको मुझ पर भी भरोसा नहीं होता है। जब मैं अगर कोई इंस्ट्रक्शन दूंगा तो प्रैक्टिस से ज़्यादा मुझसे क्वेश्चन पूछेंगे, डरे होंगे, पहले सोचेंगे ठीक होगा कि नहीं, फिर पूछेंगे ठीक होगा तो वापस तो नहीं आ जाएगी, मतलब हर पल वो डरे डरे सा बिहेव करते हैं। तो उनमें फिर ट्रीटमेंट में ज़्यादा वक्त लग जाता है और कई बार फेल हो जाते हैं। तो मुझे लास्ट ऑप्शन के रूप में मत देखिए, फर्स्ट ऑप्शन के रूप में भी कभी कभी देखिए। ठीक है, नेक्स्ट है इज ऑल हाई पिच वॉइस और फीमेल वॉइस इज पुअरफोनिया। ये बड़ा ही इंटरेस्टिंग क्वेश्चन है, इसका भी मैं आंसर दूंगा। पतली आवाज़ हाई पिच वॉइस एक सिम्टम है, जैसे कि ये हो सकता है मसल टेंशन डिस्पोनिया में भी हाई पिच वॉइस हो सकता है, फोनेटरी गैप में भी हो सकता है, टेस्टोस्टेरोन हार्मोन की जब कमी हो जाती है तब भी हो सकता है, और जो वोकल कॉर्ड नॉर्मल है लेकिन आप प्रॉपर वे में यूज़ नहीं कर रहे हैं तब भी हाई पिच वॉइस हो सकता है। जैसे कि अगर फिजिशियन की भाषा में बात करें, फीवर क्या है, एक सिम्टम है। वो फीवर बैक्टीरियल इन्फेक्शन से भी हो सकता है, वायरल इन्फेक्शन से भी हो सकता है, कई बार बहुत ज़्यादा आप थक गए हैं उसमें भी देखा है मैंने कि टेम्परेचर बढ़ जाती है, मतलब कई रीजन से हो सकते हैं। तो एक जो फिजिशियन जो है इस फील्ड के ट्रेंड व्यक्ति होते हैं वो उनको समझ में आता है कि क्यों हुआ होगा, डिफरेंट टेस्ट करते हैं या फिर अपने एक्सपीरियंस के आधार पर फिर ट्रीटमेंट करते हैं। लेकिन अगर मान लीजिए कि वो फिजिशियन कुछ मेडिसिन दिया, आपको फीवर हुआ था, आप अपने दोस्त के साथ गए थे और ठीक हो गया, अगली बार आपका जो दोस्त देखा अच्छा ये वाला दवाई दिए थे डॉक्टर साहब, पड़ोस में किसी को फीवर हो गया, वही दवाई दे दिया, लकली सेम प्रॉब्लम था, वो भी ठीक हो गया, अगली बार यूट्यूब चैनल पे वीडियो बनाएगा फीवर क्योर सेंटर, अब तो मैं फीवर का डॉक्टर हो गया। यही चीज़ स्पीच पैथोलॉजी फील्ड में हो रहा है। तो उनको जो होगा कारण तो पता नहीं होगा, तो उस क्रम में कई बार तो मैं देख रहा हूँ शाउटिंग करा करके, शाउटिंग को हम लोग वोकल एब्यूज़ मानते हैं, वोकल एब्यूज़ से वॉइस ख़राब होती है। पेशेंट को शाउटिंग करेंगे, रात भर शाउटिंग करेंगे तो कुछ ना कुछ सुबह में आवाज़ तो बदल ही जाएगी, तो उसी को चेंज कहते हैं। और फिर बाद में पेशेंट प्रॉब्लम लेके हमारे पास आते हैं। जब हिस्ट्री में घुसता हूँ तो अरे पता लगता है कि वो तो वॉइस थेरेपिस्ट स्पीच पैथोलॉजिस्ट था ही नहीं, वो तो झोला छाप का शिकार बन गए थे। तो ये सारी बातें हो रही हैं। तो सारे हाई पिच जो वॉइस होती हैं पुअरफोनिया नहीं होती हैं। तो एक जो सर्टिफाइड प्रोफेशनल जैसे हमारे जैसे लोग जो हैं वो उस प्रॉब्लम को ठीक से समझेंगे, फिर उसके अकॉर्डिंगली आपके ट्रीटमेंट के लिए सजेस्ट करेंगे। इवन सल्कस वोकलिस्ट में भी पतली आवाज़ हो जाती है, सल्कस वोकलिस्ट हुआ, फोनेटरी गैप हुआ, मसल टेंशन डिस्फोनिया हुआ, हार्मोनल इश्यूज हुआ, और कई बार वोकल कॉर्ड सब कुछ ठीक ठाक है लेकिन इफेक्टिवली वाइब्रेट नहीं कर रहे हैं। तो उस प्रॉब्लम को समझ के उसके अकॉर्डिंगली ही ट्रीटमेंट करना होगा। तो जो मैंने एग्जांपल दिया था झोला छाप वाला, उसको तो सिर्फ एक ही दवाई के बारे में पता है ना, जो कि अपने दोस्त को ले गया था ट्रीटमेंट कराने के लिए, तो वो वहाँ तक तो दिमाग काम करेगा, उसके बाद कुछ हो जाएगा तो फिर और ख़राब कर देगा, और गलत ट्रीटमेंट से वॉइस आपकी हेल्थ ख़राब हो जाती है। जब आप पेट्रोल पंप पे जाते हैं तो ढूंढते हैं ना कौन सा पेट्रोल पंप वाला अच्छा बढ़िया पेट्रोल देता है, फिर आप पेट्रोल लेते हैं। जब आपकी हेल्थ की बात आती है तो कैसे आप अरे गहरे नथु घेरे लोगों से ट्रीटमेंट लेंगे, है कि नहीं। और नेक्स्ट इज टिप्स टू, अच्छा हाँ आगे है ऑनलाइन फैसिलिटीज़ फॉर कम्युनिकेशन डिसऑर्डर एट आवर सेंटर। तो हमारे सेंटर पर कुछ ऐसे कम्युनिकेशन डिसऑर्डर हैं जिसके ट्रीटमेंट के लिए ऑनलाइन फैसिलिटीज़ हैं। तो वो कौन सा व्यक्ति ऑनलाइन फैसिलिटीज़ के लिए सूटेबल होगा ये हम डिसाइड करते हैं परसेप्चुअल इवोल्यूशन के बाद। तो आप हमें कॉल कीजिए, आपकी आवाज़ सुनेंगे, समझेंगे, फिर ज़रूरत पड़ेगी तो कुछ टेस्ट भी करेंगे, देन विल बी डिसाइडिंग यू कैन बी ए गुड कैंडिडेट फॉर ऑनलाइन फैसिलिटीज़ और फॉर ऑफलाइन फैसिलिटीज़। नेक्स्ट इज टिप्स टू कीप योर वॉइस हेल्दी। तो अपनी वॉइस को हेल्दी कैसे रख सकते हैं, तो ये सबके काम आएगा, इसके बारे में बताऊंगा। पानी खूब पीजिए, पानी एक बहुत ही अच्छा लुब्रिकेंट है, 10-12 गिलास पानी पी सकते हैं एक दिन में रूम टेम्परेचर वाले। फ्रीक्वेंटली थ्रोट क्लीनिंग अवॉइड करना चाहिए, जैसे कि बार बार नहीं करना चाहिए, ऐसे करते हैं तो वोकल कॉर्ड में फ्रिक्शन होता है और वोकल कॉर्ड डैमेज होने का खतरा रहता है। अवॉइड स्मोकिंग, स्मोकिंग करने से वोकल कॉर्ड पॉलिप होने का खतरा रहता है, तो अवॉइड स्मोकिंग। और विस्परिंग नहीं करनी चाहिए, जैसे कि अगर आप ऐसे बोलते हैं आपका नाम क्या है, आप कहाँ रहते हैं, तो इससे भी वोकल कॉर्ड पे स्ट्रेस आता है, तो इससे भी वोकल कॉर्ड और वॉइस डैमेज होने का खतरा रहता है। अगर आप टीचर हैं और क्लासरूम बहुत बड़ा है तो अपनी वॉइस को लास्ट बेंच तक पहुंचाने के लिए अपने मैनेजमेंट से एम्पलीफिकेशन डिवाइस की मांग कीजिए, ना कि यहीं से चिल्लाएंगे तो दूर तक आवाज़ पहुंचाने के क्रम में आपके वोकल कॉर्ड पे स्ट्रेस पड़ेगा और वोकल नॉड्यूल होने का खतरा रहता है। अगर आप सिंगर हैं तो भी आप अपना सिंगिंग का स्टाइल डेवलप कीजिए। दूसरे का मिमिक्री करेंगे तो वोकल कॉर्ड पे स्ट्रेस आता है और वॉइस ख़राब हो सकती है, कई बार वोकल नॉड्यूल हो सकते हैं। सिंगर है, अगर आप रियाज करते हैं तो कंटिन्यूसली आप लंबे समय तक रियाज करते हैं विदाउट ब्रेक, तो भी वोकल नॉड्यूल होने का खतरा रहता है, मेरा ये मानना है। तो बीच बीच में आपको रेस्ट भी लेनी चाहिए। तो ये सारी चीज़ें अगर अपनाते हैं, हाँ, और अगर आपको किसी चीज़ से एलर्जी है तो उन चीज़ों को पता कीजिए और उसको अवॉइड करने की कोशिश कीजिए। और अगर 2 वीक से ज़्यादा अगर आपको कोई वॉइस की समस्या हो जाती है तो आप एक सर्टिफाइड प्रोफेशनल से मिलकर अपनी प्रॉब्लम के बारे में डिस्कस कीजिए। तो इन सारी ये बातें बड़ी छोटी छोटी हैं, लेकिन अपनाते हैं तो अपनी वॉइस को लंबे समय तक हेल्दी रख सकते हैं। और थोड़े बहुत जॉगिंग, वॉकिंग ये सब भी करेंगे तो आपकी स्टेमिना अच्छी रहेगी, तो उसका इम्पैक्ट आपको वॉइस प्रोडक्शन में भी सपोर्ट मिलेगा। तो ये सारी फिजिकल एक्टिविटी भी आप करते रहिए। और बहुत ज़्यादा स्पाइसी फूड अवॉइड कीजिए, एसिड जो फॉर्म करेगा आपकी वॉइस को, वोकल कॉर्ड को डैमेज करने का खतरा रहता है। तो फ्रीक्वेंटली बहुत ज़्यादा स्पाइसी फूड मत लीजिए। तो ये सारी बातें हैं। थैंक्स फॉर वॉचिंग, थैंक्स फॉर ज्वाइनिंग। अगर आपके मन में कोई क्वेश्चन है तो आप कमेंट बॉक्स में लिखिए, उसका हम आंसर करेंगे। मैं इधर तब तक देखता हूँ, कुछ ऐसे क्वेश्चन थे जिसका मैंने आंसर नहीं दिया था। अब मैं फ्री हो गया हूँ, मैं आंसर अब दूंगा। तो एक जो बहुत ही कॉमन क्वेश्चन होता है हमारे यूट्यूब चैनल पे, ये होता है कि सर आपका कॉन्टैक्ट नंबर क्या है या एड्रेस क्या है। तो हमारे किसी वीडियो के डिस्क्रिप्शन में अगर आप जाते हैं तो आपको हमारा वेबसाइट मिलेगा। वेबसाइट पे क्लिक करेंगे तो आप हमारे जो ईमेल आईडी, कॉन्टैक्ट नंबर, गूगल मैप पे कहाँ पे क्लिनिक सिचुएटेड है तो वहाँ पे आप पहुँच सकते हैं। तो हाँ, मैं उस जगह पे पहुँच गया कि जो क्वेश्चन है, कुछ लोग ज्वाइन किए हैं और उनके कमेंट्स के लिए मैं धन्यवाद देना चाहूँगा। राम अतुर, थैंक्स फॉर ज्वाइनिंग एंड वॉचिंग। सुधीर डेंटन, वो प्यार का सिंबल भेजते हैं, हमारी तरफ से बहुत सारा प्यार आपको सुधीर। उसके बाद विपद तरन घोष, थैंक्स फॉर ज्वाइनिंग एंड वॉचिंग। सारिक खान, थैंक्स फॉर ज्वाइनिंग एंड वॉचिंग। आशीष केलना लिखते हैं, हाय हाय आशीष। और फिर सादिक खान, थैंक्स फॉर ज्वाइनिंग। एंड मोहम्मद मजीद लिखते हैं, माई वॉइस इज़ लो पिच, व्हाट टू डू, प्लीज़ सजेस्ट मी। तो मोहम्मद अजीत, प्लीज़ कॉल अस, विल डू परसेप्चुअल एवोल्यूशन एंड बेस्ड ऑन दैट वी मे सजेस्ट सम टेस्ट एंड देन विल guide you in most effective manner. So please call us for perceptual evaluation. Our contact number is in the description of this video. नेक्स्ट लिखते हैं विक्रम राणा, हेलो सर, किसी किसी को मोटी पतली मिक्स वॉइस क्यों आती है, डिस्कस करें प्लीज़। तो एज प्यूबर्टी के टाइम में प्यूबरफोनिया होता है, तो कहने का मतलब ये हुआ कि आवाज़ पतली ही रह गई। इसलिए इनिशियली में मैंने बताया था ना कि आवाज़ पतली ही रह जाती है, जो स्विच होना चाहिए नई वॉइस पे स्विच नहीं हो पाते हैं। तो एक ऐसा मोमेंट आता है कि उनकी जो वोकल कॉर्ड की जो मास और लेंथ होती है वो कंपेरेटिवली ज़्यादा वाइब्रेट कर रही होती है, तो क्या हो जाता है, पिच लो हो जाता है। और एक ऐसा टाइम आता है कि उनकी वोकल कॉर्ड के थीन एजेस ही वाइब्रेट करते, तो पूरी मास पूरी लेंथ वाइब्रेट नहीं कर पा रही होती हैं। तो ऐसे पेशेंट का भी हम लोग अगर ट्रीटमेंट करते हैं तो रिजल्ट अच्छे आ सकते हैं। तो आप हमें कॉल करेंगे तो परसेप्चुअल एवोल्यूशन के बाद और भी किसी दूसरे प्रॉब्लम में हो सकती है। 2 तरह की आवाज़ इवन मैंने देखा है, इवन वेंट्रिकुलर डिस्फोनिया में या फिर और किसी दूसरे डिस्फोनिया केसेस में। तो एग्जैक्टली एक यही रीज़न नहीं होगा, लेकिन आप हमें कॉल करेंगे तो हम ज़्यादा बेहतर जानकारी दे पाएंगे परसेप्चुअल एवोल्यूशन के बाद। लेकिन एक रफ आइडिया मैंने दिया कि एक कारण ये भी हो सकता है। और फिर विपद तरन घोष, थैंक्स फॉर ज्वाइनिंग एंड वॉचिंग। फ्रॉस्ट 95, थैंक्स फॉर ज्वाइनिंग एंड वॉचिंग। थैंक यू ऑल, लव यू ऑल, विल स्टॉप दिस लाइव। एंड आप लोगों को जुड़ने के लिए बहुत बहुत धन्यवाद। हम लोग ट्रीटमेंट के बाद भी लाइव होंगे, तो वो जो हमारा ट्रीटमेंट का बाद वाला लाइव होगा उसमें कोशिश करेंगे कि हम दोनों बैच को, जो कल लोग आए हैं और आप लोगों को एक साथ पोस्ट ट्रीटमेंट लाइव करूँ, क्योंकि आपके एग्ज़ाम की वजह से लेट हो गया है। तो आप लोग जुड़े रहिए। अच्छा, एक कंप्यूटर चेतन सर लिखते हैं, हाय सर, हाय। तो अब हम लोग इस लाइव को स्टॉप करेंगे यहीं पे। थैंक यू ऑल फॉर ज्वाइनिंग अस एंड वाचिंग अस। और आई हैव स्ट्रीमिंग, आई थिंक वो स्टैमरिंग बोलना चाह रहे हैं। तो स्टैमरिंग के केस में भी स्पीच थेरेपी से फ़ायदा होता है। इफ़ यू आर हैविंग स्टैमरिंग, स्पीच थेरेपी may help you, but sometime we have seen like in our clinic we have seen 80% treatment efficacy, especially in case of stammering. Suppose 100 people are coming for a stammering treatment, 80 people will find some good changes after the speech therapy at our center. 20 people will think it was a wastage of time and money. I am talking especially for stammering. हकलाने की समस्या की बात कर रहा हूँ, सारे कम्युनिकेशन डिसऑर्डर की बात नहीं कर रहा हूँ. तो लेकिन 80 ज़्यादा है 20 से, तो होप तो है, तो फ़ायदा हो सकता है स्पीच थेरेपी से स्टैमरिंग के केस में भी. और हमारे यूट्यूब चैनल में प्लेलिस्ट भी है स्टैमरिंग का, तो उसको एक्सप्लोर कीजिएगा तो समझ में आएगा और ज़्यादा डिटेल में. तो थैंक यू ऑल फॉर ज्वाइनिंग अस एंड वाचिंग अस. विल स्टॉप दिस लाइव. मैं एक लास्ट क्वेश्चन देख लेता हूँ कुछ. हाँ, मैं हकलाता हूँ सर. तो मैंने बताया हकलाने की समस्या का भी ट्रीटमेंट किया जाता है हमारे सेंटर पर और लोगों को फ़ायदा होता है, लेकिन अलग अलग लोगों को अलग अलग फ़ायदा होता है. किसी किसी को स्पीच थेरेपी से हकलाने के केस में हमारे सेंटर पर फ़ायदा होते हुए नहीं भी देखा गया है. और थैंक यू ऑल फॉर ज्वाइनिंग अस. थैंक यू ऑल, लव यू ऑल. और मैं एक बार दिखा देता हूँ ट्रीटमेंट के बाद जिनको आप लोग लाइव में देखेंगे अगली बार. मैं उनकी तरफ कैमरा टर्न करता हूँ, एक बार हाय बोल सकते हैं आप लोग. हाँ, तो इनका हम लोग ट्रीटमेंट के बाद लाइव करेंगे. और भी कुछ पेशेंट हैं जिनका ट्रीटमेंट ऑलरेडी हमने स्टार्ट कर दिया है, वो जो कल आए थे, और ये लोग कुछ एग्ज़ाम की वजह से लेट हो गए थे. थैंक यू सो मच. थैंक यू ऑल, लव यू ऑल.